Well, hello and welcome everyone to our webinar. This webinar is entitled Diabetes 101, Mastering the Essentials. My name is Katie. I'll be your host, and our speaker, who I'll introduce you to in a few minutes, is Ms. Michelle. So should you have any technical difficulties during the broadcast, you can call Citrix Support. There's a phone number here, and I'll read it aloud. It's 1-800-263-6317. So thank you so much for being here. So our format includes a short presentation followed by an interactive discussion. To type in a question, just use the question section of the webinar toolbar, and you'll find that to the right of your screen. At the end, you'll have a chance to ask questions, so we look forward to an interactive webinar. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So our webinar leader this evening is Michelle Dart. Michelle began her nursing career almost 30 years ago. She went on to get her master's degree and became a pediatric nurse practitioner. She has over 20 years experience working with children and adults with diabetes. Michelle became a certified diabetes care and education specialist in 2004 and has maintained her certification. Michelle's authored a nursing textbook, self-published diabetes-related books, and has been a contributing author for multiple publications, including Cecilia Health's blog. She fulfills her passion by coaching patients to make lifestyle changes that improve health and quality of life. Michelle has been with Cecilia Health since 2018, and today she'd like to support you in some basic self-management of diabetes and overall wellness. So thank you so much for being with us this evening, Michelle, and sharing with us your expertise. So you may take it away.
Thank you. Seems like my screen is lagging a little bit, but I'll just go over the agenda. So some of the things that we're going to talk about include what is diabetes, the diabetes diagnosis, blood sugar monitoring, diabetes medications. We'll talk about diabetes complications and prevention. What to eat, diabetes eating pattern. Can't really take a little bit of a glance at that, and then have some time for questions and answers. So one thing we always want to encourage is to talk with your healthcare provider before making any changes to your daily management. Even if it's something like adding some exercise, those are things that you do want to talk to your doctor about, just in case there are any concerns that you might need to consider. So the first thing we'll talk about is what is diabetes, and one thing we've seen is that type 2 is the more common form. We know with both types of diabetes, the body's not using insulin properly. With type 2, the pancreas does make extra insulin, but eventually just can't keep up with the body's needs. So we see glucose, it builds up in the bloodstream instead of going into our cells where it's supposed to go. The cells need that glucose for energy. And when the glucose is built up in the blood, instead of going to the cells, those cells become starved for energy. Type 2 diabetes can often be treated with lifestyle changes, oral medication. Sometimes we need to use insulin as well. Now, insulin is a hormone that the pancreas makes. And this helps to move that sugar from the blood into the cells, where the sugar is then used for energy. And let's see. So this is just kind of going to go through the A1C. Um, a normal A1C is less than 5.7%. Now, it can be translated into an average blood sugar level, but the A1C is really that 3-month blood sugar average. So any extra sugar in your system is going to be able to be measured. And we can tell by the life of that red blood cell that that sugar is sticking to. So the red blood cell lives about 3 months. So we can tell about every 3 months what an average blood sugar might be with that extra sugar. So that's when we get that A1C level and it goes into a percentage. Now, if you get to a level of, let's say, less than 6.5% to greater than 5.7%, then we're in a pre-diabetes range. And that's kind of, heads up, we need to start looking at things and trying to prevent the development of diabetes. So diabetes, we're going to see an A1C of greater than 6.5%. Now, we also can look at that fasting blood sugar, the fasting plasma glucose. If it's less than 100 milligrams per deciliter, we would say that that's normal. No diagnosis of diabetes at that level. If it's less than 126 or over 100, then we're looking at that pre-diabetes diagnosis again. And so kind of that red flag, let's try to halt this before it develops into diabetes, where we would see that fasting blood sugar is over 126 milligrams per deciliter. Now, this amount has actually changed over time. Recommendations do change, and the American Diabetes Association actually gives us these guidelines based on research. Each year, they're updated. So this is the most current recommendations. Now, there is also an oral glucose tolerance test that some doctors might order. If this is performed, it's where you have like a carbohydrate load, and then they measure the blood sugar at certain intervals afterwards to see how much does that blood sugar rise when we're challenged with that high carbohydrate. If those intervals, the blood sugar stays less than 140 milligrams per deciliter, that's normal. But if we start going over 140 to less than 200, we're in that pre-diabetes range. But if we go over 200 milligrams per deciliter, then we're looking at that diagnosis of diabetes. And so like I had said, the A1C does kind of give a picture of that average glucose over the past 2 to 3 months. Now, sometimes you'll hear it referred to as the estimated average glucose, which is the EAG that you see there on the screen. And that's looking at, an average glucose level 24 hours a day over that 3-month period. So it includes times where we may not see the glimpse from when we do a finger stick glucose check at home, or glance at the continuous glucose monitor some people use. So that finger stick glucose test really just looks at that one moment in time. So it's really just a glimpse at one moment, and we see those blood sugars can fluctuate moment to moment. And so the A1C is just a bigger picture. So, we want to think about what are the benefits of checking your blood sugar. You go to the doctor and they measure that lab test for the A1C and let you know. So, like every 3 months, you can find out how are things going. But when you're at home, how do you know? So, when you check your blood sugar at home, it really does give you a picture of how's your body responding to your diabetes care plan or your routine for managing your diabetes. How is it working for you? Keeping that blood sugar in range can also prevent or delay some of those long term complications. And it's especially important to monitor routinely if you're taking insulin, if you are having a difficult time controlling your blood sugar levels, if you're having low blood sugars without usual warning signs or what we would call hypoglycemia unawareness, or if you have ketones from high blood sugar levels. Um, Now, typically, we're more likely to see ketones for somebody who has type 1 diabetes versus type 2 diabetes. Um, but I can't say that somebody with type 2 diabetes would not ever develop ketones. Um, it's just more common for us to see it with type 1. Now, how and when do we want to check a blood sugar? Your doctor may have other recommendations, but we'll first talk about, how. If you don't wash your hands before you test and you have a little bit of juice or leftover food from a snack on your fingertips, it can affect that result. So you always want to wash your hands real good before testing. And if you can't wash your hands with soap and water, an alcohol swab works. You just want to make sure that fully dries before you poke the fingertip. You usually will insert the test strip, which turns on your meter, and there is a lancing device that you put a lancet in, and you want to use a new one each time you do a finger stick. Um, you would use that lancing device typically on the side of your fingertip, where it's a little bit less sensitive. And then after you've poked, you'll touch and hold the strip to the drop of blood on your fingertip. And depending on your meter, how quickly you'll see it will give you a reading on the meter's display. Um, and then how you might want to record it. Most meters will have a memory that holds it. And if your doctor can download your meter, they have all that information readily available. But if you don't have one that your doctor can download, you might want to keep a written record just so that there is some kind of record to review for patterns. But when are the best times to check your blood sugar? Fasting test is usually in the morning before breakfast. And, that's going to tell us, how are you starting your day? Um, how are things going with your overnight or your evening dose of medication? What about your bedtime snack? How is that having an effect on your blood sugar? You're going to see that on that fasting blood sugar check in the morning. Um, Testing before a meal and 2 hours after the start of that meal are other times that might be recommended. So if you test before the meal, you can kind of see where are you starting, and then testing 2 hours after, you can see how is your body handling that food? How is that body handling that meal? Um, and then you might want to, again, ask your doctor when and how often is really the right amount of testing for you. And if you feel like you're only being given enough test strips to test maybe once a day, but you would like more information, you feel like you would benefit from doing, a test before bed or that 2 hours after maybe your biggest meal of the day, have an open conversation with your doctor. They might have to work with insurance to get coverage to allow for the right amount of test strips so you don't run out. But it's a good start is to talk with your doctor about how can you make sure that you do have adequate supplies for the amount of testing that's beneficial for you. Now, um, with some meters, you can also use your thigh, forearm, or fleshy part of your hand. I just want to keep in mind that if you are using an alternative site, it may not be as accurate uh, for low blood sugar. So if you feel like your blood sugar is, really out of range, particularly a low blood sugar, you would want to verify, double check with a finger stick. Now, what are the blood sugars supposed to be? What is our target? What is our goal? Uh, so the American Diabetes Association recommends that the blood sugar should be 80 to 130 milligrams per deciliter before a meal. And then if you're doing that 2 hours after the start of a meal check, the goal is for it to be less than 180. Um, Again, talking to your doctor about what are your personal targets. You want that individualized because it can vary depending on how long you've had diabetes, your age, other medical conditions that you might have, any other cardiovascular disease or advanced microvascular conditions, which is some of the other complications. Um, that can go along with elevated blood sugars, which we can talk more about later. Hypoglycemia unawareness, where you don't experience symptoms, or just other individual patient considerations. Now, keeping a log, that is, something that can be beneficial. I know a lot of times we do like to rely on that meter memory. We just know it's there. And yeah, the doctor can print out things and look at graphs and data. But how can we make this information useful for you at home to be able to see, you know, how am I responding to different meals? So maybe keeping a record with, date and time, blood sugar result, and a little note. Was this maybe your biggest meal of the day? Was this eating out? So maybe fast food or a restaurant, maybe something different from your typical meal that you might usually have and see um, patterns for. Exercise, we know activity can have an impact on those blood sugars and feelings, whether you're tired, stressed, any other like symptoms of being shaky, all of those things can have an impact on the blood sugar. There are different um, ways to keep these records. Lots of different options might come with your meter with a little booklet. Some people will just use their own notebook, and some people like these apps on the phone. These are just a few that people have checked out and recommend. So my sugar diabetes logbook, my glucose buddy, on track diabetes, diabetes tracker, diabetic connect, BG monitor diabetes. So these are ways that you can keep those records right on your phone if you are somebody that likes the technology and would like to keep it on your phone in an app. Now, what happens if you have a low blood sugar? The recommendation is what we call the rule of 15. So, what is a low blood sugar? First of all, it's going to be something that's typically less than 70 milligrams per deciliter. Now, some people might feel symptoms of a low blood sugar at a higher number. And how to manage those symptoms when your blood sugar might be, let's say, 100, but you feel symptoms of a low, have a conversation with your doctor about how best to manage that, because if the blood sugar's been running high for any period of time, the body gets kind of used to it. And then when you're in a normal range, you might start to feel those low symptoms before you're actually in a range where we would be concerned and need treatment. So if it's less than 70, you would want to do treatment. The rule of 15 is eat or drink 15 grams of carbs, wait 15 minutes, and recheck that blood sugar. Um, if your blood sugar is above 70, then you would want to have a little snack with something with some protein. But if it's still less than 70, you'd want to repeat that whole process. Do 15 grams of carbs again, and then recheck again 15 minutes later. You do want to make sure you eat a meal or a snack within 1 hour, and that should have a source of protein. Now, if you're trying to figure out what's a good 15-gram treatment, this is a good reference. Half a cup of fruit juice, 5 to 6 ounces of regular soda, so only about half a can. Things that are easy to carry with you might be something like gummy bears or lifesavers, but you notice you have to have like 8 of them. So it's kind of a mouthful. A tablespoon of sugar or jelly, but they also have glucose tablets that are easy to carry with you and might be something worth um, checking your pharmacy and having those available for when you're out and about away from home. Now, the medication. So, uh, some people are able to manage their blood sugars through lifestyle. So, just, focusing on that healthy nutrition, getting routine exercise is sometimes enough to stabilize those blood sugars. Um, but it isn't always. So sometimes we need to add pills. We might need to add insulin, which is only by injection, or by an insulin pump. And then there are other injectable medications that work different than insulin, but do help control those blood sugars. And so the insulin, again, is a naturally occurring hormone secreted by the pancreas. With type 1 diabetes, we didn't talk a lot about this earlier. That's more of an autoimmune disease, and the body is not able to produce enough insulin. And eventually it stops producing the insulin altogether. So the only way to treat type 1 is to replace it by insulin, either injection or through the pump. Now, with type 2 diabetes, yes, the body can make some insulin. Sometimes it doesn't make enough. And the body also doesn't use it properly. So it's almost like there's a wall there and that insulin can't get through. You need a little help with some of those different treatment regimens, whether it's the pills or other injectables or the insulin. There's more than 20 types of insulin sold in the United States, and it does seem like quite often we are seeing new insulins around. Some are getting even faster acting, more stable, long acting insulins. So there's a lot of different options out there. Now, the injectable medications, they do affect the body's hormones to help lower blood sugar. Oral therapy, so looking at some of those, the pills, they're really, we say only for people with type 2 diabetes, but I'm really recently seeing where it is sometimes recommended to help people with type 1 because it is possible for somebody with type 1 diabetes to also have insulin resistance, meaning their body isn't able to use the insulin that they're injecting. So it is starting to be used a little bit more often, although I'm not sure how widespread it is, how comfortable doctors are using some of these oral medications for people with type 1. Um, but it typically had been thought to be only used for people with type 2. Now, it is going to work best when it's used with healthy nutrition and routine exercise. Um, Now, they say usually most helpful for newly diagnosed. So, a lot of times they try to use the most common treatment to start with is metformin, which is a pill, because it's easy to use and it's been known to work quite well for most people with type 2 diabetes. Um, it really is, down the road after trying some different oral medications, if they're not working, that they might introduce the injectable medications. Um, there really is no best pill for any one person. Everybody's a little different and um, responds differently to each medication. So might need to try more than one type of pill, a combination of pills, or even pills with insulin. Now, the one thing that a lot of us don't want to worry about or talk about are some of the complications that actually can occur. Um, and I think some of it is out of fear, but the more we understand, the more prepared we are to help prevent these complications. You're going to hear that broken down into microvascular versus macrovascular. So the macrovascular is the bigger cardiovascular disease, stroke. Microvascular is looking at the smaller vessels, and those are those little itty bitty blood vessels in your eyes, which can cause retinopathy. If the blood sugars are elevated, it can cause weakening of those blood vessels, and they start to pouch out and kind of weaken and leak. So you want to have those yearly eye exams to watch for that. Another microvascular disease is nephropathy, which is where the kidneys are affected. And then another microvascular disease is neuropathy, which is looking at the nerves. So high blood sugars over a period of time can wear away at that coating that surrounds your nerves. And that's when you start experiencing symptoms such as pain, burning pain, numbness, tingling. And we often see it more often in the feet, but it doesn't mean it doesn't happen in other places. So neuropathy can happen in other body areas. And now, other things that, people don't maybe talk about as much as being a diabetes complication would be depression. There's a whole grieving process that goes with being diagnosed with a chronic illness such as diabetes. Skin disease. There are different rashes, skin disorders that can be related to diabetes. And gum problems. We know elevated blood sugars can contribute to gum disease. That extra sugar means extra sugar in your saliva. So there could also be more dental caries. So you want to keep up with routine dental care as well. Now, let's see here. So, how do we prevent those complications? The best blood sugar control is going to be the key. Having that A1C checked every 3 to 6 months is the recommendation. Um, Now, the goal for less than 7% for most people, it is really where you should shoot for, unless your doctor has a different recommendation. So, why might a doctor have a different recommendation than that? If somebody has low blood sugars without symptoms, so that hypoglycemia unawareness, the doctor might not want as tight of control with the A1C because it puts higher risk for those low blood sugars. So really talk with your doctor to see what is your personal goal for an A1C. Um, those regular checkups are going to be important. Every 3 to 6 months, they should also be checking your feet to see if there's any sign of neuropathy, monitoring blood pressure. That can give us, signs and, hints into cardiovascular disease, and monitoring weight. Um, the annual eye exam is also recommended so they can look at those little blood vessels in the back of your eyes. Now, also to prevent complications, if you're a smoker, it is recommended to stop smoking because it's one other thing that can add to that strain on the heart and contribute to heart disease. So, if you can cut out any factors that might also contribute to some of these issues, that would be ideal. Cholesterol control. Typically, the doctor will do some blood work, fasting blood work to monitor that as well. Um, and looking at what you're eating, trying to change the way you cook if needed. Some people have to change from eating a lot of fried foods to maybe more baked and broiled foods. So really, look at the different areas where you get that cholesterol. It could be in your cooking, it could be in the actual meal. So looking at those food labels to see, is this something that's a high cholesterol food? And the blood pressure control is also, not only is that something that helps with the cardiovascular disease, but also your kidney health. So monitoring your blood pressure, and if your doctor recommends sometimes a preventative medication to help with blood pressure control, to just help protect those kidneys. Just make sure you understand if the doctor orders something like that, understand why are they ordering it, so that you understand and when best to take it. Um, Now, what can I eat? I think a lot of people know that nutrition's a big piece of the puzzle when managing diabetes. Uh, and it's overwhelming when we first start talking about it, especially when we say, carbohydrates. It's the carbohydrate that counts. Well, what is that? And how much can I have? And what do I do? Um, really start looking at your food labels and look at the total carbohydrate just to get an idea where you're at. And that can help if you need to start cutting down on the carbohydrates. Then you can start cutting out little bits at a time. But sometimes it's just getting familiar with those food labels and knowing what you're eating at your meals and snack times. Now, the amount per meal usually varies with individual needs. Sometimes it's easier to kind of visualize your plate. And I'm not sure if you've heard about the plate method. Um, so the plate method, we really kind of take this visual, this plate, and divide it into one half of the plate. That one half of the plate is going to be your vegetables, your non-starchy vegetables. Then you look at the other side of your plate and you're going to split that in half. Then you've got 1/4 of your plate, you're going to put a lean protein, so maybe some chicken or fish. And the other corner, that other quarter of your plate, you're going to be able to put the carbohydrates. So it could be pasta, potatoes, um, knowing that sweet potato is healthier than the white potato. Uh, Brown rice is healthier than white rice. Things like that. So more whole grains are going to be better when you're looking at your carbohydrates. Um, so if you're struggling with figuring out what should my plate look like, follow the plate method, see how that goes, see if that helps. Maybe visit a registered dietitian. Your doctor can probably recommend one. And they can sit down with you and really look at, what are you eating day to day? How can you maybe adapt some of that so you're not giving up everything that you enjoy, but how can we make what you enjoy a little healthier? Um, Now, there is a website here, www.eatright.org. You can put in your zip code and find a registered dietitian that's in your area. Um, so if your doctor can't recommend one, there's another resource. Now, www.diabetes.org, that's the American Diabetes Association website. They have some great resources for their food and fitness section, but they do have ways that help you create your plate. Let's try out different plate um, combinations and see how can I make my meals healthy. So that might be worth checking out if you use a computer or internet much. So I know that was a lot of information in a short period of time, and it really was a wide variety of information. We didn't get into a lot of specifics. Um, do you have any questions? You do have your toolbar where you can ask questions. I don't see any in there right now, um, but I'd love to, help answer any specific questions that you might have. I know sometimes the nutrition piece, again, it can be a little complicated. Feel free to put a question in if anybody has any. I'll just babble a little bit while I wait to see if there are any questions. Um, but what is it about the carbohydrates? And I think understanding how each of the different foods affect our blood sugar helps us to know why different portions are important and why that we balance the plate the way we do with the plate method. Um, so our food really is our source of energy. And those carbohydrates that we have on a quarter of the plate, they're going to be quickly turned into energy. Now, this energy that it turns into can be burned rapidly. So, just doing a little bit of household chores or something, you could burn that off pretty quick, and not we have to worry too much about the blood sugar rising and staying high because you burn it off. Um, so if we just ate straight carbohydrates and we did some exercise, we would be at risk for a low blood sugar because we can use up that energy so fast. Um, then you want to look at the proteins. The protein is also a source of energy, but it takes a little longer to turn that protein into energy and it lasts a little bit longer. So when we're treating that low blood sugar, and I say have a little snack that has some protein, like some cheese or peanut butter in it, it's to help prevent that blood sugar from going low right away. So it really is a longer source of energy. So if you're going to be doing some exercise, having a little extra protein on board can help give you that energy for a longer period of time. Um, Now, like the fats, that is going to be the last thing the body uses for energy. Um, so you do want to limit that. You want to limit what you have for the fats because we know that there's a good chance we aren't going to get to that source of energy with every activity we do. So you do want to limit it. And it doesn't give you any great source of energy, and it really doesn't have any nutritional um, factor to it. It's fat just often helps with taste and flavor, if anything else. But any questions? I haven't seen any pop up yet. I'm just wondering what other questions there might be. And I'm not sure if that maybe helped when you're looking at the nutrition piece. Just try to think about, some questions that I know I have, a lot of people that ask different things, mostly about nutrition seems to be the key. But in looking at our medication, um, staying on track with that medication, not missing any doses is going to be important. And if we're taking a variety of medicine, maybe something for diabetes, something for blood pressure, something for cholesterol, timing of medication can be important as well. So I do, recommend talking with your doctor or even your pharmacist if you're not sure how best to schedule your medication. And how do you create a schedule that you can stick to? Um, if remembering to take your medication is a challenge, I know some people like to set alarms on their phone. Some people like to use the little pill containers to kind of pre-fill them. And then you can always look and say, oh, I didn't take it yet today. So you'd be able to double check and see. Um, but everybody can, develop a system that works best for them. I know my dad would literally take each pill out of the bottle every morning and turn the bottle upside down. So then he knew he took it. And then when it came to the evening meds, then he could go back and he knew, okay, well, I've already taken this. Um, and all I need to do is worry about these ones that weren't turned over. So that's just one other thing that you could try if it's something that would work for you. Um, but I don't see any questions popping up. Anybody have any tips that have worked for them that they'd like to maybe share with somebody who might be struggling to establish a nice routine that they can stick to? Well, I'm not seeing any questions come in. I'm not seeing any tips or tricks. Um, If you use the internet, again, I would definitely recommend checking out the American Diabetes Association website because it really does have a lot of great resources um, for all aspects of managing your diabetes. And, having a support system, having people that you can reach out to and talk to, uh, I think that really helps to keep us motivated, um, keep us inspired to do the best we can for our health. Um, and I hope you all got a little bit out of today's talk. And again, it was a variety of stuff in a short period of time. Um, and if you do have questions, write them down and make sure that you take them with you to your next appointment so you don't forget, some of these things that you'd like to just clarify or verify or just question with your provider. Okay. Well, it's been nice chatting with all of you. There are other upcoming live events. November 8th, there's one embracing the holidays without deprivation, healthy eating strategies for every festive eater. I think the holidays are often one of the most challenging times for um, those of us with diabetes or other health issues where we have, food is the focus. Um, the other one is December 15th, and that is Take Control, inspiring tools and tips for becoming your own diabetes coach. So, learning how to motivate yourself and keep yourself focused and forward moving. If you want to make a note of any of those, that would be great. And feel free to register for any other live events. Okay. Again, no questions. If you need more support, you can look at these options. I don't know if anyone wanted to take a note of any of that information. Thank you, everyone, for joining us today. We really do appreciate your attendance and participation and hope to have you join us for more. You all take care and have a great evening.